Welcome, everyone. My name is Jeannie Alter. I'm the Executive Director of the American School Health Association. I'm so pleased that you all are joining us today, and we're so excited to share this important information with you, and we're really excited about our panel. And before we get started, though, I want to tell you a little bit about the American School Health Association. It's our mission to transform all schools into places where every student learns and thrives. We are a multidisciplinary professional association, and I wanted to talk with you a little bit about the benefits of membership should you be interested. We have our Journal of School Health. We offer continuing education for professional development opportunities. We have a variety of discounts, and I think probably more importantly, we connect you with information and expertise that makes up our wonderful multidisciplinary membership. So please consider joining us. Please check out ashaweb.org. We're so pleased to offer this webinar today. This is in support of a sponsored issue of the Journal of School Health. This is an open access issue of our journal that's available to everyone at no charge. And it was sponsored by the Robert Wood Johnson Foundation. And we're so pleased and thankful for their support for this issue and also for their support for this webinar today. So I'd like to pass this to Jennifer Nandu for a few words from the Robert Wood Johnson Foundation.
Thanks so much, Jeannie. Good afternoon and welcome. I'm Jennifer Nandu, and I'm the Managing Director of the Healthy Children and Families portfolio at the Robert Wood Johnson Foundation. I just want to say it is so great to see all of you virtually and otherwise on this webinar today. As I like to say, you could have spent the next 90 minutes in any place. We know that there's a lot going on in this world, and we're so glad that you spent it with us. It's our privilege, really. At our WJF, we believe that the health of the nation depends upon the health and well-being of our children and families. And in the Healthy Children and Families area, we work to ensure that all families, no matter who they are, no matter where they live or how much money they make, have the resources that they need to foster their children's healthy development starting from a child's earliest years. We seek change through strategies designed to promote health equity, and that specifically are focused on benefiting those families who have experienced long-standing barriers to structural barriers to opportunity, poor health outcomes, and the pervasive effects of systemic racism. But I'd like to anchor this webinar today in a quote that I think a lot of us have heard this year. There is no such thing as a single issue struggle because we do not live single issue lives. Those are wise words from Audre Lorde. But what I'd like to say is that is the anchor of the whole school, whole community, whole child framework that is the focus of this webinar today, because it puts forward a vision that is about people and puts children and families at the center, recognizing that they have many issues that they are anchoring as children pursue their education. We've made a series of investments to create the conditions to advance the vision inherent in the whole school, whole community, whole child framework. And we were deeply grateful for the opportunity to support the December special issue of the Journal of School Health to share those learnings and to serve as a culminating effort for the Together for Healthy and Successful Schools initiative. How our children are learning right now, currently, looks different from when we started our efforts investing in schools, and way before the special issue was conceived. But the work of learning in many ways is not different. It happens in all different forms and settings, often not within the physical walls of a school building. The evolving nature of the COVID-19 pandemic, the economic crises, and much civil unrest, which we know is in our midst, have shown just how vital schools are, educators are, and school health is to providing structure and supports for children, their parents, school staff, and often the broader community. It is also important to acknowledge that the way our educational institutions are resourced have sometimes, often in fact, been unfair and uneven, and is steeped in historical and structural sort of issues of opportunity. But that does not mean that we can't achieve this vision. As we've waded through the disruption of 2020 and into 2021, we have seen that there are opportunities and bright spots all across this country that give us hope, and the understanding that not only is an opportunity to sort of elevate the whole school, whole child, and whole community something that we can achieve, it is the way that we can ideally achieve for students across this country. And so I just want to thank you, ASHA, Jeannie, and the Journal for School Health for the opportunity to support this special issue, but thank all the panelists today for all that they have done. And for those who are on the phone, for listening in and hearing about all the rich learnings that we have. And now I am so very pleased to pass it over to Nora Howley, who has been a conspirator in the best way over the past several years. She has been a consultant to a number of the Together for Healthy and Successful School initiative work, but she also was the fabulous co-editor of this journal. So Nora, please take it away.
Thank you so much, Jen. And thank you to everyone who's been involved in this special issue, in the webinar. I want to call out a couple of people in particular. So first of all, Jeannie Alter, Caitlin Sellis at ASHA, and the editor of the journal, Robert McDermott, who helped us navigate the process of putting together a peer-reviewed open access issue. My colleagues at Robert Wood Johnson Foundation, Jennifer Nandu and Jeanette Elstein, the grantees of the Together for Healthy and Successful Schools program who actually conceptualized the idea for the issue, my colleagues at MMS Education who were the backbone of the team that did all of the work to put this together, and then finally my co-guest editor, Holly Hunt of the Centers for Disease Control and Prevention. So thank you to everyone. And of course, the authors. In our first webinar for this issue in December, it was clear that policy was an important tool for achieving equity in education and health. And this webinar then sets out to examine how we use that tool within the context of the whole school, whole community, whole child framework. How can we ensure that the policies, whether it is in their passage or in their implementation, do not work against equity? But as Jen has already noted, it would be hard to move forward without some reference to the violence that we experienced here in Washington last week. Indeed, we were rehearsing this webinar as things kicked off. Some of us may find ourselves asking, how can we focus on the minutia of policy when something like this is going on in our country? So I want to share a brief story. On 9/11, I was in Alabama with some CDC colleagues, as well as some colleagues from other non-governmental organizations when the attacks started. We were there to record a webinar. Can you imagine all of us having to travel to one place to record a webinar? And as we worried, wondered, we decided that we would go ahead and do the recording because somehow we believed and knew that what we had to say still mattered, and that schools would still need the supports and the tools that we were going to be promoting. I've never been able to watch that recording, but people who saw it months later told me that we were spot on, even as we were experiencing some of the greatest violence on our shores. So today, we know that our schools, our states, our school districts still need our help. They still need good policy, and they need good policy well implemented. So on to the webinar. We've divided this up into 3 sections with the main Q&A at the end. However, please feel free to post any questions you may have in the chat. We've tried to do our best to integrate the questions that were sent in ahead of time, but we know the questions will arise, and we will try to address them both as they come in and then again, and as I said, at the very end. Before I introduce our speakers, though, I want to start with a question to you. Please share with us in the chat what you think of when we say the term policy. So what does policy mean to you? And while you are considering that, I'm going to introduce our speakers. Our speakers today are Lora Henderson, a licensed clinical psychologist and postdoctoral research associate at the University of Virginia School of Education and Human Development, where her runs school-based social emotional learning interventions for rural, tribal, and other marginalized youth with an equity lens. Alex Mays is the Senior National Program Director at Healthy Schools Campaign and has over 10 years of experience working at the intersection of health and education. And her work at the campaign focuses on policy and program issues at the federal, state, and local levels. And our third presenter, Deb Tempkin, is the Vice President for Youth Development and Education Research at Child Trends in Bethesda, Maryland. There, she oversees the work of over 40 researchers investigating the policies, programs, and practices that support the healthy development of youth across all the contexts where they live and learn. A couple of things before I open to the first question. We're still in a period where many school districts are offering remote and/or hybrid models. And so we want to start by asking our presenters to share what they think one of the most important state or district policies that they see as integral to supporting learning under these conditions. So who would like to go ahead and get started?
Thanks, Nora. I can kick it off. So just wanted to say, echo what was said. Thank you to Robert Wood Johnson Foundation and ASHA for hosting today's conversation. And it's wonderful to be here with my fellow panelists. So one opportunity, I think in general, a key issue that our organization, Healthy Schools Campaign, has been focusing on is really looking for any and all policy opportunities to support the continued delivery of school health services. We know that when schools shut down, this was a key need that we heard was how can we ensure that students can continue to receive these services? And certainly we're talking about health services that are included in students' individualized education programs, but also services that are available to the general student population and particularly mental health and wellness services. And so we have really been looking at ways in which we can support the continued delivery and funding for those services. So the article that I wrote that's in the issue is specific to looking at a policy opportunity around Medicaid. And that's one that we really feel like is a place where we can continue to support the delivery of health services in this remote or hybrid learning environment. There's a specific opportunity where states can expand their school Medicaid programs to enable school districts to seek Medicaid reimbursement for any Medicaid eligible service delivered to any Medicaid enrolled kid. And that has really important implications as we're in this environment and looking at how we can deliver those services and bring in funding and specifically non-education funding for those much needed services. So there's been 13 states that have leveraged that flexibility. Some great bright spots are Michigan, Colorado, Nevada has done a really nice job, Massachusetts. But to really lift up, I think in general, we've been looking for those policy opportunities that can support continued delivery of school health services, but then really that funding piece and sustainable funding. And that's what I think we find particularly appealing about Medicaid is that this isn't just a one-off grant program. It's not, federal relief dollars. This is a way that we can really look at policy change that builds in a sustainable mechanism for supporting the delivery of school health services.
Thanks. Deb, do you want to?
Sure, I'm happy to jump in. So again, thank you for joining this webinar today. Really excited to talk to you. A lot of the work that Child Trends has been doing in this area has been looking at state policies and really trying to understand what is the content and what is the current landscape of state policies that are governing the work in schools. And in thinking about this question in particular, I have to think about the fact that policies don't work in isolation. In fact, the constellation of policies is really important, even when we're talking about one particular issue. So I'm going to focus on trauma. That's what I focused on for the paper that was in the special issue. And we know that it's top of mind for a lot of schools right now. We know that given the adversity that a lot of students are facing, had faced before the pandemic, that is getting worse now because of the pandemic, as well as the new stress and adversity that's coming with the pandemic itself, we know that schools are trying to address this. And actually, we know that in 30 states now, there are either policy encouragements or requirements for schools to actually train teachers in trauma-informed practices. And that's a huge increase. We only found 9 states did that in 2017. So 21 states between 2017 and 2019 added policy around trauma. So this is a really active policy area. Also, when we're thinking about states plus the District of Columbia plus Guam and the Virgin Islands, 10 of those also have non-codified policies, even when they don't have codified policies. And what I mean by codified is that those are things that are in statutes and regulations. Non-codified tend to be things like guidance documents or board documents that are coming from the state level, but don't actually appear in the quote unquote, the state code. So this is really important that there's a lot of increased recognition that training needs to happen, but we also know that simply training staff without creating an environment that actually supports trauma-informed practices can actually make things harder. And actually there's some studies that show that if you train teachers to recognize trauma without those types of environments, and it can actually increase their secondary trauma or their vicarious trauma without a lot of support. So we have to be considerate when we're thinking about policy, that simply putting a policy like train your teachers in trauma-informed practices might not actually reach the outcomes that we're intending. So we have to go a little bit deeper. So it's not just about training teachers. And we have to think about what are the aspects of the environment that we need to address? What other policies do we need to be thinking about that are going to actually address that climate so that it's effective to train teachers and pass that policy? So we need to think about things like school disciplinary practice. What are we doing that might further traumatize students, that might further exacerbate inequities that we already know are in existence? We also need to think about staff wellness. Employee wellness is one of those things where we saw very few states in 2017 addressing employee wellness, and very disappointingly, we found that only one policy between 2017 and 2019 was added to the books in the state of New York, which had already had policies on employee wellness. So no additional states started covering employee wellness during that period. If we are going to address trauma in students, we have to address employees, and I mean all school employees, so not just the teachers. Everyone who's working in that school, we need to address their mental health and their well-being as well, really to create that healthy school environment we're trying to think about. So I will leave it there for the moment, but we'll talk much deeper about this. But I think we have to think about policy, both the individual policies we want to pass and create, but also how that fits into the constellation of policies we're thinking about.
Thanks, Deborah. And so Laura, I'm going to turn it to you now. What are your thoughts on this question?
So in my work, I'm doing a lot of school-facing and student-facing work around social emotional learning and mental health. And it's great that most states are encouraging social emotional learning. It's a big thing. We hear about it all the time, but only 15 states are mandating it. So it's great that those states are mandating it, but it's something that we definitely need to see more of. Along with that social emotional learning, think about the connection to mental health. It's so important that many states are prioritizing filling the open roles of school psychologists and school counselors. But like Deb was saying, we've got to make sure that those folks are really trained to do that job, and that they're not just filling roles, and then there ends up being increased burnout and turnover. One example here in Virginia is there's a Virginia partnership grant where the University of Virginia is partnering with the Department of Education for training pre-service school counselors, and also working with counselors in schools through an ECHO model, so like a monthly learning community, so that they're not just providing information and providing professional development and then coming back to our university, but actually continuing to engage in the community on a monthly basis with providers to ensure that there's sustainability in the services that are being provided, and providing that support system, as Deb was talking about, to really support the well-being of not just the students, but the teachers and counselors and other professionals who are in the building. And my paper was on the role of culturally responsive teachers and caring school police officers for Black students who have experienced discrimination. So when thinking about the adults who are in school buildings, whether that's the teachers, psychologists, the school nurses, we also have to think about the role of school police officers as well, and the type of policies that should ensure that they're treating students equitably and really doing the job that they are hired to do in schools if we're going to have them there. I'll speak more about them later.
Great, thanks to everybody. I want to throw a question out that any of you should feel free to jump in on. We had a question in the chat, somebody asking about policies related to SEL for school districts. So I'm wondering, maybe I'll start with this one for Deb. With your deep knowledge of what states have been doing with policy, do you have any sort of tips or examples of what a policy could look like, that maybe either from the state to the district level, or something the district could use to help shape policy?
Yeah, it's a good question. And when we think about SEL, the SEL, social emotional learning, is such a broad topic. There's the SEL is in terms of what we deliver in curriculum. So actually building social emotional skills amongst youth. And in those cases, you don't necessarily need a quote unquote policy. A lot of states will have requirements or encouragements in their laws that schools actually implement a social emotional curriculum. But when we're thinking about social emotional climate as a broader, a lot of other things fit in there. So your bullying prevention policies fit in there, your suicide prevention policies fit in there, your discipline policies fit in there. It's really about what is the climate we're creating. One thing that I really encourage, there's some really great work coming out of a few organizations now. Communities for Just School Fund just recently released a report, as well as Education Trust, around this idea of how do we bridge equity with social emotional learning. So a lot of times when we're thinking about social emotional learning, too often we're thinking about how do we fix kids, or we're thinking about how do we move towards sort of an ideal how students should relate to each other, or what behavior should look like. And that ideal may not necessarily take into cultural considerations, thinking about systemic inequities. So we need to broaden our idea of what social emotional learning means to really incorporate that equity lens. And those resources from Communities of Just Schools Fund and Education Trust are really helpful to do that.
Thanks. Lora, I'm wondering, in your work, thinking about this idea of the caring school police officers, let's just lay it on the line. We saw a lot of students particularly over this past year, talking about the negatives of having school police officers in their schools. I'm wondering if you could talk a little bit about what the policy might look like for some of the positives that you found in your research.
Yep. So I think that that principals and district leaders, administrators have to play a really important role in the screening and hiring of school police officers. In North Carolina, where I'm from, there was this story last year where there was an officer who was performing unethically and was fired, and he went from a role as a state trooper to a school police officer. That should not be happening. We shouldn't have people who are not able to do their job out on the beat just being transferred into a school because that's a better place for them. It's not. So there needs to be very careful screening and planning and training of the folks that we put in schools. In addition, there are some guidelines around school resource officers. And one of them is that they often play this informal counseling role. So that's part of what we should be looking at. We should be looking at someone who can serve as a mentor, a counselor, a friend to students in a way. You shouldn't always be friends with the kids, but someone who can really build that relationship with students and whose job is to get to know students for who they are. In addition, we've got to think about what their role actually is in the school. Often they're called in for minor spats between teachers and students and called in for very subjective things. So we got to think about why they're there. They're there for if someone brings a weapon to school, or in the younger grades, if there's a custody issue and a parent shows up who's not supposed to have a child. So we should really be thinking carefully about under which circumstances school police officers are asked to intervene and under which other circumstances teachers and principals should be handling things, because that can do a great job in really limiting a lot of these negative interactions that happen when school police officers are called in for situations that they shouldn't be involved in that quickly escalate into the things that we see on the news or on social media.
Great, thanks.
And just to add to that, from a policy perspective, several states have gone to the effort of actually putting into law specific restrictions of when school resource officers can and cannot intervene, and requirements for school districts to actually enter in formal memorandum of understanding. Two things that we know are really important to what Lora was speaking to in terms of really understanding what is the role of the school resource officer on campus. So in thinking about what policy can do, those are trigger points for school districts to actually take the steps that are going to lay out a situation which is actually going to better the climate, particularly for students of color and their relationships with law enforcement on campus.
Great, thanks. And I think that's what both of you said is just such a wonderful example of how policy and practice inform each other. So, and how research, particularly the kind of research Lora says, is informing the way states and districts are writing their policy and then turning that around into the practice and the implementation. And so I think a couple of points here before I ask Alex a follow-up question. When we talk about policy, I think we are all coming into this conversation with understanding that policy in and of itself is frequently necessary, but never sufficient. And so that's the overarching tenor of this conversation. Alex, before we move on to our next area, I did want to follow up and see if you wanted to say a little bit more about some of the how some of the policies that you've been working on, or policy areas that you've been working on, can help to shape school climate, particularly in those cases maybe where schools are not fully physical these days, in the same physical space these days.
Sure. So yeah, I think there's a number of ways kind of in which that can work. I mean, we're certainly kind of continuing with the school health services vein. We've seen a lot of school social workers, school psychologists, counselors that were operating within the school building now moving to delivering those services and supporting students remotely. And I think there's been kind of a big push to look at how we can continue to ensure students receive those, mental health services that are so critically needed. And ensuring that students feel like they do have somebody that they can be connected to within the school. So we've really been looking at how telehealth can be utilized to do that. And there was a pretty quick, at the federal level, there was immediately back in the spring, a number of policies were kind of relaxed, changed that enabled states to then in turn implement policies that were very clear that, school health providers could be delivering services via telehealth. So I think that's kind of been one, is really just looking at how we can leverage that as an opportunity to ensure students continue to receive those critically needed mental health services, and that they do have an adult that they continue to feel connected to.
Great, thanks. And that's just a perfect segue into our next question, which is really thinking about both policy gaps and policy opportunities. And I think that one of the tendencies we often have that I've witnessed over the years is the idea that if we have a problem, there must be a need for a new policy to fix the problem. And so I think in this conversation, when we think about opportunities and gaps, we wanted to really look at both of those. Are there places where policies are in place and we need something to, it's about the implementation, or it's about the enhancement, or are there real gap areas such as telehealth that Alex just identified? So I'm going to throw it open and see who'd like to go first and sort of reflecting on that, on opportunities and gaps. Which of you would like to take the lead on that? I don't remember who was supposed to.
I'm happy to jump in and give some tangible examples of exactly what you were talking about, Nora. When we're thinking about policy, we often think that when there's a universal problem or things that seem to be affecting a lot of kids, that the answer is sort of a universal mandate. And we have to be really careful with thinking about universal mandates. Just because actually implementing a universal mandate can actually make things worse when there are existing systemic inequities. And I'll give a very tangible example of this. So we're seeing a lot of emphasis, as Lora talked about, around this idea of we need to get more mental health staff in schools. We're seeing a lot of investments happening there, and we're seeing more and more states passing policies that a school mental health practitioner needs to be in a school. This is great on paper. I would love every school to have a school mental health practitioner. I think we would, but it's ignoring a huge reality in the field right now, which is that there's a shortage of mental health providers. The National Association of School Psychologists points out that it's a very small field. We have very few trained school psychologists, school social workers actually available to go into schools. So when you mandate that every school needs to have one of these professionals in their buildings, it actually becomes harder for the schools who are under-resourced to actually attract and retain those staff. It's a supply and demand issue, a very basic economics 101 type issue, where school districts that can offer more are more likely to attract those workers. And so in mandating that we have this universal access, you've actually made that situation worse if you haven't also addressed the pipeline of who is going into school mental health profession. And if we think about this in a different sort of lens, we take on a targeted universalism lens, which is a really important field. I encourage you to read about it and think through, how do we think about creating and achieving universal goals by targeting our policies to those who specifically need the attention. So thinking about how do we target and make sure that the resources are going to who needs them most at any given time? How do we think through making sure that we are not creating new problems by the university policies we're putting into place?
That's such a great point, Deb. I'm wondering, at the risk of being slightly off script, because I forgot to launch the poll a few minutes ago. I'm going to pause us here for a second. And we've talked a lot about social emotional climate, social emotional learning, safety, trauma, but I would love to get a sense from our participants of where their priority areas for policy are. So I'm going to ask Caitlin to launch the poll now, please.
And just to be clear, Nora, you're wanting the WSCC poll?
The WSCC poll, please.
Mm-hmm.
Yes. And then so we're going to ask you to answer in your context, which of these, in your particular context, which WSCC components would you be prioritizing for policy? And you can choose as many as you'd like. So please go ahead and vote. I'm really impressed with our voter turnout today. We're at over 70% of our participants are voting. All right, looks like maybe we've got well, a few more people still voting. How do I see all of the choices? Caitlin, is there a way when we end the poll, does it post up the results in some kind of lovely form?
Yeah, I can share the results with everyone.
People, looks like we've still got people vote.
And you may have to expand the poll window yourself so that you can see everything. I know I had to adjust
It's not giving me
mine.
that option. All right. I think we've reached saturation point. So could you go ahead and end the poll and share the results? So it looks like social emotional climate is really at the top, but health services. So the areas in which we have been talking, but nutrition continues to be there. It's not letting me expand, so I don't know.
Nora, would you mind me popping in for just a moment?
No, I would be thrilled if you did, because
Okay. Thank you. Well, I liked your comment about, policy being necessary but not sufficient. And I think that it sparked in my mind some of the things that ASHA has been doing. And one is a collaboration with Penn State Hershey, and really looking at just what this poll gets at. What are, in this pandemic situation, what are the folks that are working in the schools, what are the primary concerns? And this poll is really in line with what people were telling us. So we did a survey, and then we followed up with some interviews as well to find out what are people really worried about with their students. And I think that's a really important piece for any policy too, is to listen about what those who are doing this work feel like is the most important, right? And so this is really, what we saw here with this poll is really what we found as well. And I think too, the other piece that once we have a good policy in place, I think Deb made a great point that we don't want to be too specific or prescriptive, and that we need, and if we're going to really embrace the WISC framework, we need to allow let's say each school or school district to be able to make the decisions that work best for their schools. And that might mean a school community partnership. That might mean mental health providers from the community are accessed versus having, one specifically on staff. So I think that I just wanted to kind of build upon those thoughts as we move forward, and highlight some of the things that ASHA has been doing along those lines.
Thank you so much. Well, and I think just looking at the results, I think we, clearly we are all very cognizant of the social emotional side of things right now for our kids and the need for services. But I wonder, Lora, in your context, what's an opportunity that you see for policy in this area?
So what I was going to comment on is thinking about, in light of George Floyd and Breonna Taylor and many other situations this year, there have been lots of anti-racist policies and statements being made. And I think that this is really a great time to build on those statements and really get some action going to ensure that we are helping all students in an equitable way, and to make schools more welcoming and safe environments for all students. When we think about the achievement gap and the exclusionary discipline practices, the disparities in exclusionary discipline practices that exist for students, it really shows us that these policies and statements are not actually being enacted and put into place, they're just talk. So it's really important that we're taking these anti-racist statements and thinking about what it actually looks like in practice. That many schools are implementing implicit bias training and other trainings for teachers and other adults in school buildings, but we know that those trainings and professional developments aren't just enough. And they even can have iatrogenic effects when you're just providing people with information, but not providing opportunities to practice and build skills and engage in ongoing conversations, specifically for folks who don't really believe in these things. When you give them information and don't do anything else, then that makes them hold stronger to the convictions that they have. So it's really extremely important for us to think about how educators and folks in school buildings are being trained and supported in enacting the anti-racist policies that are being made. There's a real gap there in action.
Thanks. So I'm just going to formally share the results here just so we can close out this portion. But Alex, from your perspective, what does it look like in a school district when the district can fill a gap using telehealth? Can you give us a real concrete example of what that might look like?
Sure. So I think, it would be that in recognizing there have been significant challenges. I mean, I think this is something when we talk about kind of barriers and looking at implementation, we have certainly seen that play out on the telehealth front. But, it would be where a child that had been in school that was receiving any, host of services. We've seen telehealth utilized to deliver, speech pathology services, occupational therapy services, physical therapy, various counseling services, school nursing services. So in the case where that student had been receiving those services in school, that, they would be in their home and have the ability to, through, connect with their provider that had been delivering them within the school building. And so that could be even just on the phone would count. That's been one of the flexibilities, is that a lot of states have kind of made it very clear that, phone consult can be utilized to deliver these services, or it could be, the provider has a computer, the child has a computer, and they're engaged in delivering those services. I think many of us have now had the opportunity to benefit from telehealth services during the pandemic. And so it's really, looking at how that can be utilized. And I should say, telehealth has been utilized prior to the pandemic. There's some fantastic telehealth programs that are out there. There's many different models. So there's really no one size fits all. We see examples where you might have, a community provider that the school is connecting the child with. There's lots of ways in which it can be done, and some really fantastic examples, but really at its core is it's making sure that child can still receive those services virtually.
So we have a follow-up question that I will think is really probably you're the first line of defense on it, but others may want to weigh in, which is, how can telehealth be used when a school doesn't have a school-based health center?
Sure. So certainly it can be used if you do have a school-based health center, but many of the models we see out there are in schools that don't have school-based health centers. So it could be that, your school, if your school is lucky enough to have a school nurse, that, your school has that school nurse, and then the school nurse is equipped with a platform. It could just be, depending on the various privacy laws that your district has in place, or at the state level, it could be, through Zoom or a platform such as this. So it could be with that healthcare provider that is within the school. So your school nurse, your school psychologist, your social worker. We also see models where there might be a district that appoints a school nurse at the district level, and then kids across the district can connect with that individual. Or we might see Howard County in Maryland has a really wonderful example that's run by their public health department, where kids can connect with community providers, but it's kind of the school that is bridging that gap and playing that role. So kind of lots of different ways that might look if your school didn't have a school-based health center.
And Alex, if I could give an example from my own personal experience. So we're lucky enough to have a social worker on staff at my son's elementary school, and on every Canvas page or whatever learning management system, you know, your school might use, there's a link directly to go to her and reach out to her. So we feel very fortunate that we have that. And we also know that not all schools have that, but being able to pull in the community providers also can help bridge some of those gaps. But that's an example from our own local school district.
Thanks. So we've had a question, Alex, I don't know if you have any publications or resources that people might be able to look at, but if you have something that you want to drop into the chat, people are looking for information on concrete examples. But I'm wondering if this, to Deb's point a few minutes ago about shortages, you know, do any of you see telehealth as something that could continue post-pandemic? I mean, Alex talked about it as a before, but you know, what are some of the policy opportunities for carrying things on after?
Go ahead, Alex.
Yeah, kick it off, and I can piggyback on your comment.
Sure. So I think, as Alex pointed out, a lot of the opportunity that happened during the pandemic is largely a result of a lot of waivers being issued. So waivers in terms of whether telehealth services can even be prescribed, waivers in terms of who can provide those services, a lot of policies that actually were relaxed in order to actually let these things happen. And so those right now have an expiration date. They get extended as unfortunately the pandemic continues. But for some, they're not intending to extend it beyond the end of the pandemic. And I think one of the opportunities, as we've seen some really good success stories coming out of this, is to try to see if we can extend those waivers beyond sort of their expiration point at this point. Another challenge, just to raise another challenge here, is that there's a different certification between those who can provide services at a school setting and those who can provide services sort of in the community setting. And this also goes to who can and can't bill Medicaid. It gets really technical very quickly. But there's opportunity to rethink how do we actually think about certification as it pertains to telehealth, as it pertains to school-based health, as it pertains to community health, in order to broaden the pool of available providers.
So Deb, are you saying that sometimes the best policy is less policy?
Sometimes it really is. Again, policy can have unintended effects. In some ways, we try to put in policy because we believe it's going to have positive impact, but just as some of the programs that we know and love have been implemented and shown to actually increase the very thing they were trying to prevent, we have to remember that policy can do the same thing. That's why it's really important that if we implement a policy, we evaluate the policy, and sometimes we take back those policies. Having policy does not necessarily mean it's a good thing.
So, as somebody who spent my life in policy, my heart breaks. Before we move on, I do want to reference some of the conversation that's been going on in the chat, where there's been a really robust discussion around the policies around certification of teachers in the health education and physical education areas. And we certainly don't have the time today to go into those in depth, but I think ASHA, you've got, you might have the topic of an upcoming webinar brewing in the chat, because it is a complicated issue, and it is one that is often driven by shortages. So just to flag that. One of the things that we have to recognize about education in the United States in particular is that in some ways it is a hyper-local undertaking. We have a long-standing historic and cultural allegiance to the idea of local control of schools. I spent a number of years working for an association that represented state leaders in education, and every one of those state leaders told me how local they were. And they each were going to be more local than the next state. So with that in mind, we frame the next question to ask each participant to think about the state and districts where they physically are, and sort of to take it to their local areas. So if you could advise the state or district leaders where you live and work, what policy areas would you be advising them on? And Laura, were you going to go first on this one?
So in my work as a clinical psychologist, I'm often asked by school districts about implementing social emotional learning curricula. And so we do a lot of those student-focused interventions. Students have these behavioral issues, students that, what can we do for the students? I like to take a step back and talk to school districts about what they can do with teachers, counselors, school nurses, and other adults in the building to support student social emotional learning and really the social emotional climate. I'm really big on examining policies and procedures that are impacting the exclusionary disciplinary practices that are occurring, and also looking at the achievement gap and thinking about how we can examine what teachers are doing and what administrators are doing that are contributing to these gaps that we see. So really looking at the teacher and adult focused interventions and taking a step back from pathologizing the children and throwing lots of different interventions at them, but thinking about what we can do as adults to examine our policies and procedures, while also attacking things from the other lens with the student focused interventions as well.
Thanks. And I love that connection of policies and procedures, because they do go hand in hand. So Deb, Alex, who's next on what would you do locally?
Go for it, Deb.
Okay.
Yeah,
So I am based in Maryland, and Maryland is one of those states that has a lot of policy. So Maryland has a lot of policy on a lot of things. And one of the things that I would encourage them to do is really to look at the broad landscape of what they have and how it's intersecting. And I say that because, again, thinking about the WSC model, one of the main things about the WSC model is coordination. And thinking about the fact that all of these things, health education, health services, social emotional climate, physical environment, they all intersect with each other. And so passing individual policies about individual things doesn't necessarily help us get to that coordinated, really big picture view. And it actually can create some issues. So just going back to thinking about, for instance, passing policy about PD for trauma, there are a number of states that have 11, 12 different requirements just in the school health space, not even including academics, for professional development requirements for teachers and other staff at school. If you think about that, I don't know when in a school year they're expecting to train teachers on those 12 different topics. So the idea of, well, how do they overlap? Bullying and trauma and suicide, they all overlap. They all have the same sort of risk and protective factors. You have some similar procedures that you need to think about when you're addressing those issues. How can we think about this holistically? So if I were talking to the folks administrating this in Maryland, I would say, can you look at your full landscape and see how you can streamline, see how you can make this easier so schools can actually implement these policies with fidelity.
Great, thanks. And again, just to pick up on that last word of fidelity, so often policy runs the risk, and I think the more policies we have in a particular area, the more likely it's established, they become a checklist and not a real commitment to changing, to something that drives a change in practice. So Alex, what about you?
Yes, and so I agree with what Laura and Deb said. I would love to see that done at the local level here. I'm in Oakland, California. I think just kind of building on what has been said, and then some of the threads of the other conversations. I think one potential, I hesitate to say silver lining of all this, the school closures, but silver lining is that I do think there has been increased recognition around the role that schools play in terms of supporting student health and wellness, that there's now we understand, and then not necessarily everybody, I know there's still tremendous work to be done, but I think there is increased recognition that schools are providing school meals, that they are delivering health services, that they do a tremendous amount in terms of supporting the emotional health and wellness of students. And so I think, you know, at the local level, what I would love to see is just kind of looking within existing policies that are in place at the district level, where there might be opportunities to integrate more focus on health and wellness, and whether that's through existing professional development programming, whether that's through, you know, curricula, kind of within the policies that are there and the guidelines that they have, where can we really, you know, shore up and highlight what we now know and what we have known, but now what more and more people know about, you know, that critical connection between health and learning. So I think really taking a hard look at those policies and thinking about where there might be opportunities to do more of that integration and alignment.
Great. Thank you so much. So I'm going to turn to a question now to our participants, our audience, and ask, we've been talking about sort of gaps, challenges, but there are bright spots. And I think Alex just gave us, again, a lovely segue into the idea that there are bright spots. There have been some creative, innovative work done. So if you could just share in the chat, what policy issue, healthy school policy issue or area has been a bright spot in your work over the last few months? So let's hear some bright spots for policy wherever you are. And if you want to share where you are, that would be great. We'd love to hear what those are. While people are having a chance, I hope to answer that question, I am going to just share a reflection because I'm also in Maryland. Like Deb, and her point about this coordination really hit home for me. Just thinking back to my year when my children were in school. Lloyd Colby, who used to be the director of the Division of Adolescent and School Health at DASH, used to say that every school has uncoordinated school health components. And so that if we just sit there and look at the WSCC model as a set of checklists, you know, yes, we have nutrition. Yes, we have health education. Yes, we have PE, but we don't have enough of it. Yes, we have some employee wellness, but we don't do it very well. Whatever it is, if those things are not working together, we don't actually have the WSCC framework in action. We just have a set of uncoordinated components. So I'm seeing some of the positives coming in. The value and the need for school
Lloyd is on this webinar, so you better talk nice about him.
You can see the full list. I can't. Well, I'm very flattered then. So some of the positives that are coming in are the value and need for school nurses, flexibility around school meals. Yes, that was one of the things that I saw really early on, was some real creative, and again, Deb, you probably know this in more detail than I do, but made possible by some waivers, right? So work days or well-being days for staff who are teaching in person. Trying to see what else is coming in. More SEL awareness. So yes, so there's definitely some bright spots. So before we move into the general Q&A, I wanted to ask each of the participants one of our presenters one final question, which is if you could each just take a minute to say what's next in your policy work over the next couple of months. So jump in, whoever would like to go first.
So
go ahead, Deb.
Okay. So mine is quick and easy, but really exciting. So we have partnered with the National Association of State Boards of Education through the generous funding of RWJF, thank you, Jen, to update our landscape analysis of state policies. It is currently, and I will put the link in the chat for all of you, up for 2017. The 2019 update will be up on February 3rd, along with some analysis of current trends, what we saw change between 2017 and 2019, as well as a very interactive, easy to use, clickable Tableau dashboard that you can use to understand the policies in your own state as well as the country. So we're excited to relaunch that next month.
Very exciting. And Deb, I'm going to just ask you one thing. So that's done. It's just getting ready to go. Click buttons so that it's live. But what's next for you for policy work? Where are you going to be focusing your attention?
So we're doing a couple things. So we really want to do a deeper dive into thought about equity and taking this targeted universalism lens. So we will be putting out a couple of briefs in the coming year, really thinking through the impacts of specific policies on specific groups. So look for that. We are also, through some work we're doing with Kaiser Permanente right now, looking at what is the federal landscape of school health. So one of the things that we know is really frustrating for a lot of school districts and states is that there are a number of different agencies at the federal level that fund school health, that support school health, but all talk about it in a different language, all define it differently. So we are working on creating a landscape of all of the programs, all of the agencies that are affecting and talking about school health, and essentially making, I'm a little bit of a social network geek, so we're making a sociogram showing which agencies have the most programs and the most connections around school health.
That sounds amazing. I can't wait. Laura, what's next for you in your work?
So my work is very applied here at UVA with the National Center for Rural School Mental Health. We're adapting some SEL interventions for rural schools. So in addition to going into the schools and working with administrators to roll out these interventions in their school, a lot of the time we're helping them figure out what that actually looks like for them. There's some schools that are just like, give me the intervention, we're ready. But there are other schools where we help them figure out what it looks like for them to implement the policies and procedures and who's going to do it if they don't have a full-time counselor or full-time school psychologist. So really helping schools to implement these interventions, but then also figure out what it looks like for them to implement policies and procedures that are passed down at the state and district level for them.
Great. And knowing that you're focusing on rural, do you have sort of what makes a rural, an elevator speech on why rural or what makes rural different?
There are lots of things that make rural different. Students in rural areas often, on the SEL and mental health side of things, often have less access to mental health care. So schools are really important for prevention services, and the SEL is even more important. So that's a big piece of why we have this National Center for Rural School Mental Health that's focusing on improving mental health and strengthening SEL programs and school climate in these rural schools. We also know that there are immense strengths in rural schools. Communities are very tight-knit and close, so we're really building on the strengths to address some of the challenges that rural communities are facing.
Great, thank you. And Alex, what's next for you?
So on our end, we're continuing to really lean in around the school Medicaid work that Healthy Schools Campaign has been leading for the last 4 or so years. So we really do feel that supporting states in expanding their school Medicaid programs and really recognizing schools as another site of healthcare and making sure that school nurses, school psychologists, social workers, all your school health providers can be getting Medicaid reimbursement for eligible services is a key opportunity to bringing in much needed resources, but then really to supporting the expansion of those services. So we run a 15 state learning collaborative, which I can send the link out to, that has state teams that are really digging in around this issue. And so we will continue to do that, and then engaging with other states outside of the Learning Collaborative as well to support them in making the policy changes needed to ensure that they're really maximizing Medicaid as a funding stream for school health services.
Great, thank you. I'm going to go off script for a second and ask Jen if you wanted to just briefly share what's new and coming from your team at RWJF. She says 1 minute. All right, I'll ask Jeannie to go ahead and what's up. I know you're going to talk a little bit more about ASHA at the end,
Sure.
but is there something related to this that you'd like to share here?
Yeah, we're really taking the opportunity right now with the incoming administration to really make sure that WISC is something that they're aware of, which I believe that they are, but we want to make sure that that message is upfront, making sure that schools are well resourced, whether that is funding or professional development, which we also play a part in. Our strategic framework is around lead, educate, and activate. So we want to make sure that we're offering high quality professional development. And also we are about to release an advocacy primer to help folks and activate people at all levels to be able to advocate for school health at the local level all the way up to the federal level. So we are doing work in that area. We're taking advantage of the opportunities that this transition will provide. So that's what we're up to in a nutshell.
Great. And Jen, do you want to share anything?
Sure. So sorry about that. I was on mute and I was actually getting ready to drop the link to the Together for Healthy School, Successful in Schools initiative. So I was juggling a bunch of things.
Sorry.
But I would just say, like, we're really looking at and reflecting on a couple of different things for families and children across this country. I just elevate that we know that families are experiencing fairly tough times right now. And that's not a state or a condition that's going to change, but there's going to be lots of conversations about what is the infrastructure that we can support across this country, and what are our economic recovery strategies. And we think it's a really important time to actually elevate that this is not about, just in keeping with this theme of policy, and it's not enough to sort of put policy in place, not building off of flawed policies, but really thinking about the opportunities for transformation that put resources into families' hands and ensure that all of our children are in settings where they can develop and learn. So we're focused on that, and we've dropped the link for Together for Healthy and Successful Schools if you want to sort of check that out and the resources there.
Thanks. And I will just want to second Jen on the healthysuccessfulschools.org link that is in the chat, because that really highlights the work of all of the Together for Healthy and Successful Schools grantees, and the tools that they created. So the marketing, the messaging campaigns, the social network analysis tools that came out of Washington University in St. Louis. I mean, those are all linked there, and all have the potential to help folks think about this policy development and implementation landscape. So it's now time for our formal question and answer. So please feel free to start dropping questions in. One question that I want to ask while people are getting their questions in is I wanted to actually ask Deb, in the analysis that is upcoming, you talked about one of your findings around the expansive growth in policies related to trauma. Were there any other big surprises in that analysis, good, bad, or ugly?
I wouldn't necessarily say they're surprised. It was surprising. I think it goes along with a lot of the things that we were sort of seeing in the media, because policy often responds to what folks are focusing on and what the general public is talking about. So from between 2017 and 2019, the big focus in school health really surrounded the conversation following the 2018 Parkland shooting. And so we saw a lot of policy movement in the fields of security and safety, as well as student mental health. One of the things, just sort of going back to one of the discussion points earlier, of the 20 topics that we saw move, I think about 6 or 7 of them had to do with professional development. So these are increases in mandates around professional development again, around mental health or safety or topics like that. Also cultural responsiveness or implicit bias training was in there as well, Laura. But this idea that we are going to create safer schools by simply mandating professional development seems to be a theme in a lot of the policies that we're passing, which again, all of these topics are related. So wanting to see how can we streamline this to make it easier for schools to actually implement.
Great, good point, because for those of us who are rooted in education, professional development is usually seen as a good thing, right? I'm doing some work now on another project, and it is all rooted in the need for teachers to have greater professional development in the topic of interest, which in this case is reading. And yet your point that we might, in fact, overprescribe in terms of just the sheer number of waking hours that educators have is a great point. We had a question, Jeannie, about saving the chat, whether the chat can be saved and included in what's sent out after the webinar. So I don't know whether that's something you normally do, but we also had a note from Jen that you can save the chat by clicking on the 3 little dots in the box, which I didn't know. So I have now had my professional development for the day. Thank you.
Well, me too. Thank you, Jen. Thank you.
And some other great resources being posted as well. So another question that I have, and I'm still looking to see if there are new questions coming in. We talked a lot about teachers. We talked a lot about counselors and nurses. Those of you who know me know that I really am very interested in the folks who aren't the professionals in the schools, the custodians, the bus drivers, the clinical aides, etc. Any thoughts from any of our speakers about how policy can support those folks in the work they do, or examples of good policies that do that? So, Alex?
I think to say, recognizing that, they all play a critical role. And I think I wish I had good examples. Deb might know of some, but I think, as we look to schools reopening safely, I just can't, overemphasize the importance of including all voices in the development of policies to reopen those schools and ensuring that bus drivers, custodians, et cetera, are at the table for those conversations and really thinking about how to do that. So I know as conversations have started to happen around that, we've heard anecdotally that in some cases that is happening, but agreeing and echoing, kind of building on what we were saying before about having key voices at the table.
Alex, I think that's really important. And if schools have a school health team, then having the transportation director there, maybe the director of custodial services as part of that group, I think it's really important, because right now I think there's an awareness of the contribution of these really important roles in our schools that we didn't have before. I think just in sort of the general, consciousness. So I think it's really important for them to be involved, and also to have a voice to be able to say, this is outside of our capacity and we need more assistance. I think that that's key, because they're being asked to do a lot more than they've been asked to do in the past.
Yeah, and particularly
Deb or Laura, anything kind of, sorry,
particularly in thinking about coronavirus safety, one of the things that I've been observing, even as people are thinking about sort of the vaccine rollout plans, is that teachers are starting to appear in, the tier 1B, I think it is in Virginia or other places, but we aren't seeing the other school staff. And a lot of the concern that has happened sort of throughout the pandemic around when to open is that a school is not a community just of teachers and students. It's a community of teachers and the custodians and the school lunch ladies, and excuse me, that was gendered, I'm sorry, the cafeteria workers, et cetera, right? The school is not just educators and students, it's a whole host of folks. And so opening a school doesn't just affect students and teachers, it affects a lot more. And the demographics and the risk factors of those who are helping to support schools often look a lot different than just the teacher and the student population. And so we have to be very mindful of that as we're thinking about how to best support the whole school community, not just the students.
Laura, anything you want to add on that?
I was just going to mention that in our work with implementing SEL curricula, we often hear that teachers don't have time for this, or we don't have a counselor who can do this. So we really help teachers and administrators to think flexibly about if there's this instructional aid, or if there's this bus driver, or just Miss So-and-so who everyone loves, this person can do it. Our curricula are written really clearly with lesson plans and PowerPoints and things that anyone can use. So we've had some success, and not just teachers and counselors and psychologists implementing the lessons, but some of the other really important adults who play a really key role in rural schools where the community really comes together to make things happen.
Okay, thanks. And we had a great comment, which I want to just highlight before I turn to a question that's come in, which Karen Kirschbaum pointing out that many times the folks who work in these support roles actually live in the community, and so are an important source of family and community engagement resources, bridges, etc. So thanks for that, Karen. We had a question from Aaron, Mom, I think, Deb, for you about the policy analysis, asking if did many of the policies talk about measurements or ways to measure if the policy was successful?
Yeah, it's a really good question. So most policy does not have an evaluation component. And what I can say about our analysis is that we only looked at the text of the policy. We did not look at implementation, which is a huge gap, which we very much acknowledge. But it's something that we hope the policy analysis can actually be used as a resource to do, and actually understand what are the effects of these policies, what are the effects of the changes that we've seen over time. I do think that this idea of measuring whether a policy is implemented is so very important. And some of the work that we do with the District of Columbia, we help support the implementation of their bullying prevention program. And what we found when we first started doing that work is we went through and we analyzed all of the LEA. So if you know DC, DC has DC Public Schools and then about 65 charter local education agencies. So we looked at all of the policies to see if they were compliant with the law. And on first review, only about a third of the policies were actually compliant. So the idea of getting to a point where they were actually following the law took a couple of revisions with each of these schools to get them up to have their policy. Now, whether that policy even worked, we don't know. What we're seeing, sort of tracking it long term, is that the rates of bullying in DC haven't changed very much since about 2014, which is when we started doing this work. But again, this idea of policy, just because you have a policy doesn't mean the policy is actually being implemented. It doesn't mean the policy is actually going to work.
Great, then that is such an important point. And again, just to really sort of stress that it's a multi-stage process. Is there a policy? Yes, no. Is it compliant with the requirements for said policy? And then does it do what it was actually intended to do? Or does it do something else? And I mean, I'm oversimplifying what is a very deep and complex process, but it's never enough when we think about policy to just say, is the policy working?
I would add to that, there's also the difference between the letter of the law and the spirit of the law. And I can give you a very concrete example where in DC's bullying prevention law, they talk about that consequences need to be flexible to account for the developmental age of the students involved, that need to account for the severity of the incident. So we had schools say, yes, we'll vary the consequences based on the severity and the developmental age, and the available consequences are suspension and expulsion. which does not get to the spirit of what I think the council was actually trying to get at when they were talking about the flexibility consequences. But because they said, yeah, we're going to vary it based on all of this, and there's two options, either suspension or expulsion. Technically, they're compliant with the law, the letter of the law, but I don't think they're very compliant with the spirit of the law.
Right. And Aaron just adds that it's important to think about also, is the policy current with the highest level of evidence about the issue at hand? So, well, I'm just sort of going to put out one more call for questions or comments before we wrap up. This has been an amazing discussion. I always enjoy talking policy with folks. If people who are in our audience have not seen the special issue, I really encourage you to check it out, because it was actually really hard to decide which of our authors to invite, because there are really policy implications in every one of the articles that we that was selected. One of the things that I find so amazing about the Journal of School Health as a member is the requirement in the research articles that they include something about what are the implications for school health as an explicit section of the article. And I don't know of any other education journal that does that. And so you have a discussion, you have your conclusions, but then you have this real focus on the practicalities of school health. And all of our authors, including the three who are here today, of how well they were able to draw policy into their implications and understood the power of policy. So I'm not seeing any new questions come in. So I want to just thank everybody and turn it back over to Jeannie to see us out.
Super, thank you so much. Thank you, Nora, for your skilled facilitation of our conversation today. I really appreciate it. And thank you so much to our panelists. This is a really wonderful opportunity to just kind of take a deeper dive into these issues. And I really appreciate your time and willingness to be here today, as well as to contribute to this wonderful special issue. And I really appreciate the support of the Robert Wood Johnson Foundation and your collaboration. You all have been a joy to work with, and I'll be sad to see the project end. So for all of you, thank you so much for being here today. I want to let you know that we have, and as far as continuing education, we have 1.5 hours available for from NCHEC if you are a CHES or MCHES. Also from NAPNAP, and if you need a participation certificate, whether that's to submit to another certifying body or to provide to your employer, we also have that available as well. So there's a survey, an evaluation in the chat box. We'll also send it out after the webinar. Members will receive free continuing education credits. And non-members, there's a fee. So we're happy and thrilled to be able to offer that to you all today. Just wanted to make a note of some upcoming things that ASHA is working on. Stay tuned for our 2021 ASHA webinar series schedule. We're putting the final touches on that. So we're going to have a very full and robust series of webinars for 2021. Also mentioned earlier our advocacy primer that will be coming out very soon. And also stay tuned for details for our 2021 School Health Conference, which will be our 95th, I believe. Wow. So stay tuned for all of those upcoming opportunities. And if you would like to continue the discussion with any of our panelists, I've included their email addresses here. And please, here again is the healthysuccessfulschools.org website. So thank you so much to all of you who participated today and for your contributions, and have a wonderful day. Thank you, everyone.